endocrine system, right? You have to know first the relationship between the hypothalamus and the pituitary gland, right? So, do you guys know what the name of the, I mean, it's called the pituitary gland, but what do we call it? Do you guys know? No. They call it the master gland. So this is a lot like, I have a way to memorize this. So they call this the master gland, but it's actually the hypothalamus that controls everything. The hypothalamus, which is above the pituitary gland, it's got all these nerves and blood vessels that are attached to the entire blood system, and it can tell how much of a specific hormone is in the bloodstream. So the hypothalamus, think of it like the Illuminati, okay? And then think of the pituitary gland like the president. Now the president gets the title, but in reality it's the Illuminati that controls everything, right? Well, it's kind of the same thing. The hypothalamus controls everything. It knows how much of a hormone you have in the bloodstream, and then it'll tell the pituitary gland to either increase or decrease its respective hormone. Does that make sense? Mm-hmm. So, the pituitary gland releases a bunch of hormones. Let's talk about thyroid stimulating hormone. This is the hormone that stimulates the thyroid gland. The thyroid gland is on the anterior portion of the neck, and it controls what we call metabolism. Okay? And you have to know that this hormone tells the thyroid gland to either increase or decrease its respective hormone, which is T3 and T4. Those hormones control metabolism. If you wake up early in the morning, how do you feel? What's your energy like? It's very low, your metabolism is low, your body's a little bit colder, your heart rate's slow, you're not really awakened. Your metabolism is slow. But as the day progresses, your eyes know that the sunlight's out, it sends a signal to the brain, your hypothalamus recognizes that it's daytime, and what's supposed to happen to metabolism? It's supposed to increase. So it starts increasing TSH, so it could also increase T3 and T4. Does that make sense, guys? That's how, this is called the negative feedback loop. At nighttime, when it's time to go to sleep, your hypothalamus knows that we have probably too much of this, but it recognizes it's nighttime, you're laying down, you're going to sleep, so then this says, okay, it's time to go to rest. And it'll decrease its TSH secretion, and therefore it'll also decrease T3 and T4, and then you'll go to sleep. That whole relationship is called the negative feedback loop. That's how your body regulates hormones. It's not consistently releasing hormones. It only tells it to increase or decrease whenever the hypothalamus detects that there's either too much or too little, or we need a little bit more. Does that make sense, guys? Okay. We also have another hormone. It's called the adrenocorticotropic hormone. It's very important. This, though, ACTH, has a relationship with the adrenal cortex, with the gland, the adrenal gland. The adrenal glands sit on top of the kidneys, and they produce aldosterone, cortisol, and androgen, sex hormones. We're going to focus on these two first. You guys have to know that aldosterone increases salt reabsorption at the kidneys. And if your body keeps salt, what follows? Water. So you maintain hydration. Your cortisol increases sugar levels, blood sugar levels, and this is just salt right here, right? So cortisol is a hormone that makes your blood sugar go up. Now, we need these hormones, especially this one right here. It's known as a stress hormone during stressful situations. If you imagine back in the days when we were hunters and gatherers, if we got hungry, could we just go to the refrigerator, to the McDonald's and get some food? We had to go outside and pick the berries, find the water, hunt the animal, right? Mm-hmm. So when you're walking outside and your body develops any stress, like if the sun's out, what happens to your fluid volume status when the sun's out?
Sweat.
You start sweating. Your body releases aldosterone to increase salt absorption so you can maintain hydration. Does that make sense? At the same time, if you're out there hunting for food, if you have to think about how to set the trap, if you have to think about where the berries are at, where the fluid is at, what's happening to your blood sugar level as you become physically active? It goes down. And so you need to stay sharp to find the food, to hunt the animal, right? So cortisol increases blood sugar levels so your cells can have enough sugar so they can utilize their function, so the neurons can fire their synapses so you can think. That's what these hormones are responsible for. You need to understand that. These hormones are supposed to help you out during what type of situations? Stressful situations, right? At that point, you have to consider that they're either going to be hyperfunction or hypofunction. Have you guys heard of Cushing's and Addison's syndrome? Mm-hmm. Do you guys know which one's high, which one's low? Which one's high? Have you guys ever been to Venice Beach?
Yeah.
You guys ever seen the Rastafarian guys asking you want some kush? What do they mean by that? Smoke. What happens when you smoke kush? You get
High.
So from now on, Cushing syndrome is hyperfunction of these hormones. So you have fluid retention, you have hyperglycemia. And what happens when you're really stressed out? Before COVID hit and I was teaching at school, whenever there was a final exam, I knew which student had herpes. Because during stressful situations, you see all the cold sores on their lips. So what I'm trying to say is that stress suppresses your immune system.
You must break out in eyes.
That's correct. Yeah, they do. So these stress hormones, when they're elevated for too long, they affect your immune system. By the way, does that make sense, guys?
Yeah.
And then the opposite is Addison's. You have to add. But what you guys have to do is memorize the hormones and what essentially they do. Okay. Any questions on that so far? Inside right here, you have the medulla, which is the innermost aspect of the adrenal gland. Do not confuse that with the medulla oblongata, which is part of the brainstem. This medulla releases catecholamines, which is your epinephrine and your norepinephrine. And the most common disorder that you guys are going to encounter with the adrenal medulla is something called pheochromocytoma. Pheochromocytoma. And you guys know that OMA is cancer. So young men usually get a tumor in here. Now, if you understand that the adrenal medulla releases catecholamines, epinephrine, norepinephrine, what does that do to your blood pressure? Epinephrine and norepinephrine. These are your that's correct. Hypertension. So when people have pheochromocytoma, the main sign and symptom is hypertension. And it happens usually to younger men. Although it can happen at any age, but that's statistically when it happens. Does that make sense, guys? Okay. Let's talk about another hormone.